Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast. May is Mental Health Awareness Month, and that is a time to recognize the importance of emotional well-being as a key part of overall health. Today, we're going to focus on the connection between mental health and diabetes, and particularly how managing a chronic condition can affect the emotional lives of people living with diabetes, as well as their families. And we'll explore the challenges, some of the challenges, share supportive strategies, and talk about the way that your healthcare providers and each of us as caregivers can help. The American Diabetes Association is not an organization that specializes in mental health and only seeks to bring awareness to factors that coincide with a diabetes diagnosis. If you're experiencing challenges, seek the support of a licensed medical or mental health professional. Please note that this episode includes discussions of sensitive topics, so we encourage you to listen with care. And there's a lot that we're going to discuss, and there's a lot of information out there. I'm Dr. Neil Skolnik, Professor of Family and Community Medicine in the Sidney Kimmel Medical College of Thomas Jefferson University, and joining me as always is my co-host.
Neil, thanks so much. I think this will be a great discussion today. I'm Dr. Sara Wettergreen, an assistant professor at the University of Colorado Skaggs School of Pharmacy and an ambulatory care clinical pharmacist.
And joining us today to discuss this topic is Dr. Kelsey Brzezinski, who is a pediatric psychologist at the Lurie Children's Hospital of Chicago and an assistant professor of psychiatry and behavioral sciences at Northwestern University's Feinberg School of Medicine. Welcome, Kelsey.
Thank you, Neil. I am really glad to be here.
We're so glad you're here too. And to start the conversation, can you please explain the relationship between mental health and diabetes?
Of course. So we know that some mental health conditions like anxiety or depression can be more common in people who are living with a chronic illness, such as diabetes. And part of this is that some people with diabetes will just also have depression or anxiety that isn't necessarily related to their diabetes, but it may impact their diabetes care. So anxiety and depression can both keep people from doing things that they enjoy doing, or it can keep them from engaging in things that they would like to do to take care of their health, like their diabetes regimen. We also know that chronic illnesses like diabetes can really take a toll on people. So they can be stressful. Diabetes in particular is demanding. It's a 24/7, 365 condition, and you don't get to take a break. So people may feel additional stress because of their diabetes. They may be worried about long-term aspects of their care or financial aspects of their care, and this can really impact mood as well.
Yeah, it's critically important. We often under-recognize, I think, how much of a toll any chronic disease can take. And this is true across disease states. If we look at something that is documented, depression, and we look at the population at large, you have about a 10 to 12% of people have depression. For chronic diseases in general, it's almost double that, not quite, and that is across chronic diseases, and diabetes is no exception because of the toll it takes in so many ways, and we'll get into that. In addition to depression and anxiety, there's something called diabetes distress, which is particular to diabetes. Kelsey, can you tell us a little more about what diabetes distress refers to?
So diabetes distress refers to a variety of negative emotions that are specific to diabetes. So it could involve feeling sad about diabetes, anxious, burned out, frustrated, or angry. And you can probably guess there's a little bit of overlap there because it involves sad feelings like depression, anxious feelings. But it's really important to note that this is something that is distinct from depression. It's distinct from anxiety for a couple of reasons. One of those is that it's really specific to diabetes. So you may have diabetes distress and you may not have those difficult emotions about other areas of your life. And another reason to note why it's different is that diabetes distress is not really a mental health or psychiatric diagnosis. It's actually something that is really common and normal for people with diabetes to experience because diabetes can be so frustrating, so demanding. It's something that most, if not all, people with diabetes will experience at one point. We do know that it can exist along a spectrum, and we do know that when it is significantly elevated, it can impact people's ability to engage in their diabetes care. It is actually a really strong predictor of things like A1C and diabetes outcomes. So we want to make sure that we're screening for diabetes distress when people are experiencing it and that we're treating it appropriately.
Now, Kelsey, you say screening for diabetes distress. How would you go about, and we're primarily directing our podcast to people with diabetes, not to healthcare practitioners, but how would someone know whether they're experiencing diabetes distress?
Yeah, it's a good question. I would say if you're experiencing, as I mentioned, it's really normal to have some of these feelings about diabetes some of the time. So you might be experiencing some diabetes distress some of the time if you're having times where you feel particularly burned out or frustrated or sick of diabetes. You may be experiencing more significant diabetes distress if you're noticing that you feel that way a lot of the time, or that it's getting in the way of things you need to do either for your diabetes or for other aspects of your life. So if you're so burned out because of diabetes that you notice that you're not really checking blood sugar as much, or you really would want to avoid engaging in your self-care with diabetes, that would be a sign that maybe it's becoming a problem.
And I think you probably answered my next question in a way, but I'll ask it anyway, which is how does diabetes distress then affect A1C? Because you mentioned often it leads to a worse A1C.
Yes, so it can affect individuals' ability to engage in their care. People might have more missed appointments. They may not be working together with their healthcare providers as much. All of these are some of the reasons that diabetes distress may have an impact on A1C or time in range over time.
Now, I mentioned earlier the prevalence of depression, and we know diabetes distress is distinctly different. What is the prevalence of diabetes distress? And I say this particularly, Kelsey, because I think we often don't like acknowledging that we're having a tough time. But when we are, it's also helpful to know that many other people like us are as well.
So the estimates vary a little bit based on the studies that are used. I would say that some studies would estimate that as many as 1 in 5 people have severe diabetes distress. Some samples, it's even more than that. So it tells us that maybe as many as half of certain samples are experiencing what we would consider to be clinically significant or really elevated diabetes distress.
Yeah, I've heard those numbers before, and when something is that common, it, at least for me, leads to introspection. And so I think, could I be affected? And by addressing this, are there ways that I can help my health outcomes? What are some ways that you see that people can help themselves? First, identification, and then how do you address diabetes distress?
Yeah, I think there are a lot of ways to address diabetes distress. And I really like to think of I like to think of a lot of things with diabetes as really involving teamwork. So your care team is part of your team, your family, caregivers, all of those people are involved. So I think a great first step is to include the people in your team and kind of talk with them about what some of the challenges might be. And when I talk with care providers, I will talk with them about diabetes distress and give a suggestion of, I think a great place to start is by talking with people about what is bothering them the most about diabetes. So if we can narrow in on what's the most frustrating, the most upsetting, the worst part of diabetes, that's a great place for us to think about how can we shift that a little bit.
Those are great insights, Kelsey. And when I think about diabetes distress, I'm thinking of the people that I care for in my own patient panel who are experiencing this. And you're exactly right. I think it's even more common than we might think. And you start to hear these growing frustrations over time, or you hear people say, gosh, I wish I could just take a vacation from diabetes, but you can't, right? It's something that lives with you day to day, 24/7, 365 days a year. I did read a study recently that showed that diabetes distress is more common in people using insulin, people in the age range of 18 to 64 years, women, people with financial challenges. So, thinking about those factors, I start to think that's a good number of people that I work with. And how good of a job am I doing from my own clinician perspective of bringing this up? And so, in thinking about our conversation today, I would encourage our listeners to reach out to your care team if you are experiencing this, because we'll do our best to try to identify these signs that maybe diabetes management is getting trickier, but it's not always as obvious as we would want it to be, so we can make those changes. So, in my own clinical role, if I identify someone who is struggling with diabetes distress or other mental health conditions, I think about how I can safely scale back a plan. Maybe you can't take a diabetes vacation, but what can we adjust for a temporary period of time? I think about how diabetes comes with you through those ups and downs of life. I've worked with people who are experiencing grief, mental health challenges, diabetes distress. And in those times, I think about the people who might be scaling back either way. So whether they talk to me or not, they might not be checking their glucose as often, they might not be taking their insulin or other medications as consistently. And so I'd rather work with someone who is facing those challenges to adjust the care plan where we can. So for example, instead of my usual monthly follow-up, maybe it's every 2 weeks, maybe scaling back the glucose monitoring from a finger stick multiple times a day to once a day, or maybe a few times a week, depending on the individual scenario. So I think there are some things we can do that maybe are not a vacation, but can help support. Kelsey, what are your thoughts?
Yeah, I think so. You're mentioning what I think is one of the greatest interventions for diabetes distress, which is figuring out ways we can take some of that burden off of the person with diabetes plate. So I work mostly with kids and teens. So sometimes that involves bringing in caregivers and talking about, is it really helpful for a parent to take on certain responsibilities, even if it's temporary or it's just a really stressful time? Or can we lean on some other people? But yeah, I think reducing burden is an excellent place to start.
It's interesting, Sarah. You said something that I want to pick up on, which is about telling your healthcare practitioner about what's going on. And a lot of times, it just seems to me, we always think other people know what we're going through. And most of the time, they don't. And so I think of times where I see people in the office and I don't realize what they're going through. And I might be busy that day. I might be trying to get through my office hours. But when someone says, wait a minute, Dr. Skolnik, can I share something with you? I also always find the time to say yes. And I don't think I'm alone in that. I think we, as healthcare practitioners, doctors, nurses, pharmacists, PAs, nurse practitioners, we want to be there for our patients, but we don't always think to ask. And I'd really encourage members of our audience, if they feel that they're struggling, whether it's with depression or anxiety or with diabetes distress, I'm feeling overwhelmed, let us know that. And then it's up to us to respond. And that response is often a creative one. I know that for myself, one response, depending on someone's ability to come back to the office, might be, let's sort through what you're going through that sometimes requires another visit, but I can listen then, and I can understand and then come up with a plan that includes, Sarah, some of the things you were mentioning. Your thoughts, Sarah?
Oh, yeah, exactly. I try to ask as much as I can, but just as you said, Neil, sometimes I miss it. If someone's A1C goes up, if they've missed appointments, if I see they haven't filled their medications in a while, just ask what's been going on. And the responses can be anywhere from an individual mental health challenge. It could be diabetes distress. It could be my partner just died, or I just got this diagnosis that really scared me, and that's now the focus. And so I think it's normal, as Kelsey had said, that there will be times where diabetes management feels more or less stressful. And if everything else going on in your life is more stressful, then adding diabetes into that might be more difficult. And so I think there are going to be these times that ebb and flow. But for some people, we know in thinking about Mental Health Awareness Month that this is more of a consistent challenge. And so when it's more consistent, I think finding those resources to really help day to day beyond the let's just scale back temporarily, this is a short term solution versus what are our long-term solutions. So when I think about that, I think about connection to mental health professionals like Kelsey to get support. So in thinking about that, Kelsey, you are a great resource for us today, but you can't meet with all of our listeners one-on-one. I would like to share a resource from the American Diabetes Association that recently was updated, and it's a mental health provider directory. We'll link it in the show notes for today's podcast, or you can use your internet browser if you just search ADA Mental Health Provider Directory. For me, it was the first thing that came up. And it's a great tool to find providers in your area who specialize in working with people living with diabetes. I practiced this myself. I searched in my area, clicked on some special interest, and the tool provided a nice overview of multiple provider options, their backgrounds, which insurance carriers they accept, if they offer telemedicine as an option, lots of different information. So I found this tool very simple to use personally, and I know how challenging it can be to find a provider in your area. So I really like this tool. Kelsey, I'm curious, do you have any other recommendations on how to go about finding a provider if someone is looking for additional support?
Absolutely. So I really like the mental health provider directory as a resource. I always really encourage people to talk to their healthcare providers. I think sometimes diabetes care team might already have familiarity with some folks who are really great in the community. I also think primary care doctors are an excellent resource. They tend to know really great therapists, really great mental health providers. Some of those people may or may not have experience with diabetes, but they may be willing to learn a lot. So those are places to start.
Kelsey, I'm wondering if you can share with us some of the things that mental health providers might be able to offer, because I recognize that when we're feeling overwhelmed, we feel like no one's going to be able to help. If you can just give us a sense of the type of help that is available.
Of course. So I would say the good news is that we do have a lot of really effective ways to treat both mental health concerns broadly and diabetes distress. So just because these things are common, a lot of people experience them doesn't mean you have to live with it. If there's something that's bothering you, I really want you to seek out the support because we have a lot of ways to help people feel better. So as a psychologist, I am trained in a number of different therapy techniques that can help people with these sorts of skills. So just to name a few, there's cognitive behavioral therapy, mindfulness, motivational interviewing. Other mental health practitioners like a psychiatrist or a psychiatric nurse practitioner can also bring in medication into the picture if that's recommended. So some of the work that I do involves helping people learn ways to deal with difficult emotions, understanding more about how our thoughts and feelings are related to our behaviors. And then since I'm someone with a really strong interest and focus in diabetes, a lot of the work that I do actually involves talking with people about their diabetes goals, health-related goals. So if that's, I really want to work towards checking blood sugar more and taking insulin at every meal because I know that down the line, that's going to help with my A1C we can talk a little bit about what might be getting in the way of that and what can we do to address that.
That's so helpful because I have seen so many patients helped so much by psychologists and licensed social workers because I'm so glad you went over the set of techniques, and there are lots of them that can then be individualized to really help people. Sarah?
I agree, Neil. That brings me a lot of hope to hear all of those options. I imagine if you're someone who is listening to this thinking, I don't know what's next, I don't know what would really help me, you can hear from listening to Kelsey that there are so many different approaches that can be used in these care visits to support diabetes and mental health concurrently, whether that be adjusting the diabetes medication plan to try to make it more simple, whether it be thinking about what supports you in your own mental health to better support your diabetes in the long run. I think both of those are such key elements. And of course, being the pharmacist, I love to hear that medication use is part of the conversation too. Absolutely. Now, Kelsey, I know you are specialized more in the pediatric population, and something you mentioned earlier, I'd like to dive a little bit deeper into. You mentioned when the mental health of a child is affected, how that might relate to the dynamic with the caregiver and how both of their mental healths are into consideration. Could you speak a little bit more to how a child's mental health might affect their diabetes care plan and how parents might get more involved or caregivers and how caregivers' mental health is also on the docket too?
Yeah, so part of why I love working with kids is I love working with families. And we know there's a ton of research in the psychology literature that, when one person in the family has a mood concern, anxiety, that impacts other people in the family as well as family relationships. And as I mentioned before, I really focus on teamwork, and teamwork within the family are such an important part of diabetes care. So everybody with diabetes, regardless of your age, you need a support system. For kids and teens, I do a lot of work with kids, teens, and their families about how can we more effectively communicate when it comes to diabetes. So how can we work together instead of feeling like there's times where we're working against each other or my parents are driving me crazy because they won't stop asking about my blood sugar. We can often come to some agreements that work better for each person individually. And then I would add that it is really important for any caregivers to find ways to take care of themselves. So caregivers can also experience diabetes distress. It's not necessarily just the person who's living with diabetes. So making sure that if your loved one has diabetes, if you're involved in somebody's care, that you're finding ways to take care of yourself as well is really important.
It sure sounds like that isn't just when you're a parent of a child with diabetes. And I think the truth is that it is hard. It's always hard bringing up kids. It's hard living in a family. It's hard not living in a family. And to ask for strategies that can help, there's always a lot of help available. We only have a few minutes left today on our podcast. Kelsey, do you have some final thoughts that you want to share with our listeners?
Yeah, I would just say the biggest thing I can say is your diabetes team, your healthcare team is here to support you in all aspects of your health, including your mental health. Please reach out. Please talk to someone if you feel like there's something that's bothering you. And it's okay to start small. It's okay to start with the thing that feels most important to address.
Sarah, your thoughts?
My final thought, it echoes something that Kelsey said, is thinking about that team approach. Whether you're a caregiver and you're part of the care team for your child or your loved one who's managing diabetes, or you're reaching out to your healthcare team as a broader part of your team, it's not something that you have to fight alone. It might feel like that at times, like you're managing this day to day on your own since diabetes is living with you day to day, but it is something that you can get support for.
So important. It's interesting. I have a small little plaque that hangs in my office because I had heard this saying and I had asked an artist to actually make me a plaque. And it says, never suffer alone. And I think that we all go through things. And when we have any chronic disease, including diabetes, things are hard. And we all are there. There's someone here that wants to help. And we are also all imperfect. Let us know if we're rushing through a visit. I think a main theme that we're hearing is whether it is your pharmacist like Sarah, whether it is a psychologist like Kelsey, or your primary care physician like myself, reach out. There's a lot there that is available. I want to thank everyone in our audience for listening today. Remember that seeking support is a sign of strength, not weakness. You're never alone in this journey. If you or a loved one are experiencing a mental health crisis, please call the 988 Suicide and Crisis Lifeline. Alternatively, you can call the SAMHSA, SAMHSA Mental Health Helpline, which is a no-cost, confidential, 24/7, 365-day-a-year treatment referral and information service that is available at 1-800-662-HELP. That's 4357. We'll put those resources in the program notes below. And those are important, but for many of us, it's the day-to-day issues, whether it is depression, whether it is anxiety, whether it is diabetes distress, the challenges that really are challenging that come with the diagnosis of diabetes that we live with day to day. And I think the main theme for our program, and Sarah, thank you for, as always, for hosting, and Kelsey, thank you for joining us. The main takeaway message is reach out if you feel like we can be of help to you. For the American Diabetes Association, I'm Dr. Neil Skolnik. Thanks for listening.